Yeah, so it's sort of fortunate that the speaker who should have been speaking has a healthcare challenge, I understand. So not a serious one. I wouldn't make light of it. Hopefully, it's just a minor injury, and so we fortunately work in this space as well. So I work in a project at the Grantham Centre, funded by EPSRC, that's just completed on surveying some of the challenges in healthcare. And we looked in particular at dentistry, because I work at a dental school, but also looked at vascular surgery, and in fact pictured here in an orthopaedic unit. And so we were interested, and my colleague, Professor Nick Martin, who's a clinician, is very interested in trying to create sustainable dentistry, which is, as I think you're going to see, quite a challenge. But it does follow on quite nicely from what Sophie was saying. So by way of very brief background, healthcare generates a huge amount of waste per annum, including over 133,000 tons of plastic waste, which is a huge amount of CO2 burden. Now, it isn't quite comparable to the food sector, for example, but it is right up there in the same scale, even if not quite as large. Now, currently, less than 10% of our waste is recycled. None of our packaging is recycled. I think maybe a tiny fraction goes off. For example, I think Bristol University use it to make models for children in hospital units. But really, nothing happens to this, which is kind of strange, really, when like me, you visit healthcare settings and you see the quality of the waste and the cleanliness. The vast amount of our waste is not contaminated. So really, there are many reasons why we should do better in healthcare. So why do we think that we want in particular to look at plastic waste in healthcare settings? Yeah, so as I showed you a minute ago, over 20% of our waste is plastic. Yeah, it's quite a high percentage. The vast bulk of that is non-hazardous waste. And when you look into the palette, as it were, of polymers that we use in medicine, perhaps not surprisingly, there are not that many polymers that you find. Really, only half a dozen make up the vast bulk of the waste that's there. Much of that is reprocessable, and or those plastics that are not readily reprocessable, we could perhaps replace them with other materials that are. So there's a huge opportunity in healthcare. Now, one of the things which we think is both a complication and a positive is clearly it's a very controlled environment. And I would like to think, although I dread to hear that Sophie could prove me wrong, that because it's so highly regulated, that very little of our waste finds its way into the hands of criminals. I think that the waste streams from healthcare settings are incredibly well controlled. So we have lots of challenges, though, as you've heard already. There are technical challenges around the identification and reprocessing. There are huge regulatory challenges that we face in healthcare. And some of those regulations, it has to be said, they're there for patient safety, quite rightly, and indeed the safety of staff. But many of the regulations are not necessarily logical when you look at them in detail, and could be revisited. There are, of course, risks of cross-infection, and you need to make sure that they're managed. But again, in our boundaried settings, they are managed very well, and there's no reason why they couldn't continue to be managed well if we improve our waste recycling. And then these are very bureaucratic environments, obviously, again, for good reasons of patient safety and welfare and the welfare of staff. But that management environment could be modified in order to make better use and better use of recycling opportunities. So much of this, and I've learned, is really, I'm a bench scientist really, but I've learned so much of this is about the culture and behaviours and about behaviour change that we're seeing really taking place. Of course, it's not spontaneously, but because of the efforts of people like who are gathered here today. But there's suddenly a very large interest in the healthcare community in improving our management of waste. And of course, the public are a big part of that too. So it is a very challenging and complex environment, but there are some positives. So in terms of complexity, here's an application we made recently that sadly wasn't successful to NERC, probably because our volume of waste wasn't quite high enough for them to hit their government targets. We think the proposal was very, very strong in other ways, but they needed to show a very large tonnage impact, and we couldn't quite show that. But you can see it broken up here, the complexity into stakeholders, where we have both the clinical needs, the regulatory frameworks, and of course businesses are hugely important in this space as well. And this goes right through from at every stage, from raw materials and manufacturing through packaging, phenomenally important, distribution and sales and procurement, which takes place, of course, generally in a healthcare setting, where there are end users, whether you could say that's the patient or the clinician, and ultimately landfill. And we discovered already many fascinating things about this chain. And so, for example, the people doing the procurement do not really communicate much with those doing the waste management. And so you could save a lot of money, for example, in procurement, but then have to spend your savings doubly so in the cost of disposal because of the uncoupling of these important stages. Yeah. So I won't dwell on here that this really sums up the complexity of the problem. But the one advantage that we do have, I think, it lies in here as well, and that is it's what they would call a bounded site with strict controls. So it is an area where you have an opportunity to introduce change and manage change to quite a high standard compared to, say, working with, for example, the public. We have, I think it's fair to say, highly trained and increasingly highly motivated staff around the issues of waste. And we have very high standards of professional practice among clinicians and, of course, among all of the supporting staff who make up a clinical healthcare setting. And we have huge amounts of governance which could easily be extended to the quality and safety of waste and waste disposal. So we've done a lot of work on understanding the environment. I promised to stick to 10 minutes, and this is really only an introduction, so I can't go through the data, and I didn't have a chance to gather that ready for the presentation today either. So we have undertaken a proof of concept study where we've been in different clinical settings in hospitals and dental practices, and we've evaluated what currently takes place and looked at where waste streams are managed. We've done a lot of work on the quantification of plastic waste, which is mirroring and supporting some of those big headline figures that I showed you at the outset. And we've identified the waste plastics that are generated, and we've categorized them and worked with Manchester and identified potential reprocessing routes that could be used to better manage these waste plastics to make new feedstocks for a circular economy, which I think is one of the themes of your event today. And then we've also looked at the drivers, regulatory drivers, and also the demands on manufacturers around packaging and other single-use plastics, and divided them into contaminated and non-contaminated. And we've drawn up some new management strategies for waste that we're hoping to implement in our teaching hospital. And what we've also done, that's a policy at Sheffield University, is we've brought in sustainable healthcare into our education profession. So we now teach this. As a result of our participation in this study, we teach this to our young dental professionals, both clinical dentists and hygiene therapists, and our Bachelor of Science programs and Master's programs. So our sustainable healthcare is embedded now in all of our teaching. So it's one project has had a very valuable impact on our education. So I should acknowledge a couple of postdocs here who work with us, Harriet Baird and Peter Fazese. We work with a lot of academic staff in different areas. Tom Webb in behavioural science. Alec Rothman is a vascular surgeon. Seb Spain is a polymer chemist. Sarah Baker, a psychologist. Nick Martin is our lead as a clinician. James has just left us to go to Cardiff. He's also a clinician. Steve Mulligan is a general dental practitioner. Jonathan Hoare is another of our clinicians. So we have a very multidisciplinary team, which is, I think, another of the themes that Sophie very much introduced in her presentation. So I wanted to show this slide. This was our unsuccessful bid, but just to show we have a huge amount of industrial buy-in as well. And as you've seen already, there's a huge interest and drive coming. Industry are often, I think, wrongly portrayed as the bad people in our environment. The industry are as keen or keener than ourselves to introduce a much more green, sustainable healthcare environment. So on that note, I'll stop, and I hope that was interesting and maybe not as good as you would have got from your primary speaker, but hopefully never enough to stimulate your interest in this field. Now, how do I push that button? So, back in the room.
Excellent. Thank you so much. Are you able to